Hello, everybody. My name is Osmo Kontula. I will now share my screen with you. I will present to you what kind of impacts COVID-19 has had in Finland on relationships and sexuality. And my study was done in 2020. As we all know, COVID-19 has had a major impact on our social lives of all inhabitants around the world. And in Finland, a large proportion of a working population moved to work remotely at home. And it changed the interaction with their partner if they had one. It caused very often impacts on their interaction and also on sexual desire. And positive and negative impacts can be studied and understood by conducting a qualitative study where people can present freely and describe how COVID era in practice had impacted their social and sexual life. And I have conducted a large-scale study in summer 2020. Almost 4,000 people and almost 3,000 women and 700 men responded to the online survey that I had prepared. The survey was published on the website of Helsingin Sanomat, that is a leading newspaper in Finland. Respondents were selected evenly of all age groups. This survey had a total of 25 questions, and 10 of these questions were open-ended, so people can write freely on these topics that were named in these open-ended questions. And this is very extensive qualitative text, a lot of text, that I conducted a thematic analysis that I will present to you. I can't present all the questions and all the results, but I will show you wordings of the key open-ended questions for this presentation. There was first one general question of specific fears and concerns in COVID era, and it was worded: has the coronavirus epidemic raised some particular fears or concerns in your mind? If yes, tell me about them in your own words. And in addition to this general question, there were questions if the quality and interaction of a relationship had changed in some way, and if sexual life or desire changed in some way during the coronavirus epidemic. Wordings: if you are living in a relationship, has the quality and interaction of your relationship changed in some way as a result of a coronavirus epidemic? If yes, tell me in what way. Has your sexual life or sexual desire changed in some way during the coronavirus epidemic? If yes, tell me how. And about these general fears and concerns, briefly, the main issues that were raised in this text that people sent to me. Generally, it was very often mentioned that it was a worried and fears the economy in Finland and in the world, and also negative impacts on the society as a whole. This was very general feedback. But our major feedbacks concerning these fears and concerns were fears of one's own or loved one's death, concerns of the health of loved ones, fear of negative effects of continuous loneliness, fear if the COVID epidemic will never end, and fear of negative impacts on mental health issues. And lastly, concerns for relationships in general. What happens to them and whether other people can be hugged anymore. There was a lot of respondents who were living alone, and they were worried about this issue of loneliness. So, and they were hoping that someday they still find a partner. Concerning the social impacts on relationships, this COVID-19 era had almost as often either positive or negative effects on the relationship based on this text that people sent. Most often positive impacts have been the result of a possibility of spending more time together in a relationship thanks to a coronavirus and remote work especially. There has been more leisure time thanks to less time spent on traveling to a workplace. People worked at home, so they didn't need to travel mornings and evenings. Increased time spent together and increased leisure time together had been seen to have improved the relationship and increased the opportunities for everyday affection. On the other hand, being together all the time had felt too stressful when there was no chance to be alone. A partner had been found annoying and disputes had escalated. Here are examples of these positive impacts on the relationship. And generally, they mentioned that quality of relationship was improved, partners get along well, had cozy time together, there was more time for discussions, there was increased affection, cuddling, partners felt comfortable together, they lived life to the fullest in a moment and felt responsibility of each other, and common routines worked well. So these positive effects of the Corona era. And here are some citations how they described this change. So it had improved relationship very much. We've had more time together, enjoyed being together. I wish it was always like this. We've been outdoors, talking and having hobbies together, the best time of our lives. Very positive citation. We haven't been together this much in our entire 20 years marriage. Now it's just the two of us working remotely at home. Experience has strengthened our marriage, and I have really congratulated myself for the good choice I made back in the day. And our relationship has been strengthened by the awareness that even in exceptional circumstances and with close cooperation, the other person's face does not get bored or argue. Our sex life has improved now. When we have more time for each other and there's no power and no time spent on anything extra. But there was also quite often negative impacts on relationship. Most importantly, continuous togetherness has been hard and mentally burdensome. The presence of the other person irritates when you can't be alone. Emotions throw away, unexpected fights and controversies arise. The partner seems boring. And citations. Constant togetherness tests nerves in a whole new way. Someone else's behavior annoys a lot more than before when you can't catch your breath at work or meet friends. In this case, both were working remotely at home. We've been both annoyed each other so much. Often the other one gets annoyed even if he doesn't say anything, probably because we are together all the time. And there was also a constant dispute about the seriousness of a COVID situation, and so how seriously it should be taken, and the need for related restrictions. partner did not want to listen risks anymore. Because of this, there had been even discussions of divorce. And citation: the biggest challenge has been my and the spouse's completely opposite attitudes toward restrictions. We've had more fights than ever. He wants to live a perfectly normal life. At first, the situation has driven us to consider whether our values are too different for a relationship. I think my husband is selfish. He thinks I'm hysterical. And some more negative impacts on the relationship. The partner's traits and behavior had become irritating. People had been left without the mental support of a partner. It was hard to meet other people. People had expected more time of their own or alone. Citations: the walls have sometimes fallen on the top when we are continuously together and there have been so many disputes. It's a strain to be with a man all the time. You can't ask your own friends to come over because family is always home. And so because of COVID, it has been difficult to organize time for meetings. One can be at a risk group, and hence there will be the ban on appointments. Sometimes people had to break the plan. Sometimes partner was in abroad and was not allowed to travel for the joint meeting. Many missed the time together. The children were present all the time and the atmosphere was tense, and many were afraid that their relationship was ending. There was a threat of relationship breakup. And now about impacts of COVID era on sex life. On generally, in 2020, there was twice more often negative than positive effects on sexual desire and sexual activities in this qualitative data. Some had sexual desires and sex more often than before because they had more time that they could spend together with their partner. But more and more people's sexual desire had decreased due to various concerns, and often sex had stopped even altogether. About the positive impacts of COVID on sex life. Some had desires and sex more often because they had more time that they could spend together considerably. And citations: this was thanks to teleworking, reduced stress, not feeling tired, feeling relaxed, and a possibility of having sex during the day. We talk more, there is more intimacy, cuddling, and sex. We are even more tightly a me spirit team, and we enjoy each other's company. My sexual life has been activated. I'll have more time for my new girlfriend when my hobbies and other expenses have been cancelled. So the spouse was felt closer and there was more cohesion with him or her. The spouse seemed more desirable. The need for intimacy has increased clearly, and there has been more calmness in sexual intercourse. There is more room for mutual enjoyment, much more joy and variety. More about positive impacts. There was more sexual desire because people wanted comfort and intimacy in a crisis. It was something that they really needed. They could desire more because they had more free time and had been allowed to rest. It inspired them to engage in sexual experimentation or masturbation. Citations: sex with a man was very nice. There hasn't been an epidemic in mind. Perhaps the lifestyles have been so they have increased so that the beautiful bodies have encountered. There has been more sex, but we can't go all the way when the basic conditions is tired, exhausted. I've masturbated almost manically. But there was a lot of also negative impacts, so more often negative impacts than positive impacts on sex life. More people had a decrease in their sexual desire and sexual activities due to various concerns and pressures, because they have no partner, and sex had often been stopped altogether. And with number of reasons why there was a decrease in sexual desire and sexual activities stopped altogether: concerns, stress, anxiety, fears, unwillingness to take risks, fatigue, working pressures, no time to desire, not power enough. Some considered that it is not a good idea to desire sex and to be intimate in this COVID situation. Some say that the idea of a partner was disgusting and the sex was well repulsive. It would require too much to have even sex after all of this, what is happening. Citation: I'd like to have sex the usual way. My boyfriend can't do it right now. He's very distressed, and the only intimacy is resting on his lap. I'm trying to understand him too, but I still feel frustrated. If people did not have a partner, they often had stopped to look for it because of COVID era, or they could not beat their previous lover. One example. On the other side of Finland, I have lovely secret love that I'm crazy about. We haven't been able to meet for over 2 months, and I have missed him so much. More reasons for these negative impacts. This sex had decreased often because of children were constantly at home. Children went to bed very late, and after that people no longer had the energy to have sex. There was no good time for sex. Citations: when the children are constantly at home, the previous luxury of having sex with a spouse during one-to-one working days has stopped. Sex now only takes time for evenings when you are often too tired. The touch has stopped, and the sex because of kids have been at home a lot, and that always means the end of sex in us. The spouse insists on an empty apartment so that nothing should be heard. And even sex is the last train it would take to do this. That's where the little night's sleep would go. Kids wake up many times a night. You can't take a side into care for grandparents, so sex has been miserable for at least 3 months. Sexual life is on ice. And there was a number of stories as sex has decreased because children were constantly at home. So this story still continues. We parents of young children now have no chance of a one-to-one time when the whole family is home all the time. Kids can't go anywhere with grandparents or friends. Children stay up late and wake up early, so the parents' very own time has not been and is not in sight for months due to coronavirus restrictions. You could have sex, couldn't have sex at all the whole time the school were closed. When the holidays start in a week, the mandatory celibacy begins again. You can't hire a babysitter, and grandparents can't take children. You can't spend the night at hotel or send kids to sleep over anywhere. So the epidemic has completely destroyed intimate relationships. The constant tinkering and movement of a family teenagers at home in the evenings who are next to our parents' bedroom, and of course our own stress about both the coronavirus have taken away their sex life drive, and there has been no sex during this time. Still more negative impacts. Also, the constant presence of a partner has reduced the willingness towards the partner. The other one annoyed him or herself. There was nothing new about him or her. He or she didn't cause any more longing. It felt like they were a sister and a brother. There had been more disputes in a relationship. citations. In COVID era, there was less visual stimulation that would inspire sexual desire. Passions have subsidized when we are just home all the time. I've noticed that willingness requires life outside of a home distance. Otherwise, we'll be together like sister and brother. There's less sex you don't want to light up when you see someone all the time. When one is always at home, masturbating is also difficult. That's where you are amused by someone else, and I don't think you feel like that either. Many had been afraid even to kiss with their partners because of COVID. So finally, a brief conclusion and recommendation. It is necessary to develop advisory services, how to use positively the common or joint time in the relationships. But parents need enough time to stay on their own without children being always present. There is also a need to develop the ability to detect and to see the partner as desired, even if he or she is constantly present at home. There is a need to find boundaries for one's own time and to stay also separate in the relationship. That is important to see other people as sexy. I thank you for your attention for my presentation and all the best for you.